So we talked about all of the interventions we have for Tier 2 and Tier 3, and then our Tier 1 expectations. But a lot of this we really want to take back to our entire team, because really there's only 2 of us here from our team today.
Okay.
And so we feel like it wouldn't benefit to completely fill this out now. So we want to wait for them. But we are able to go through each of the elements of this and see what we have and what we don't have and what we need to work on.
Okay, good.
So, do you want me to just talk about what we?
Go, yep.
Okay.
Go right ahead, go for it.
Okay, so we selected check and check out as our Tier 2 intervention. Expected outcomes vary, but we kind of generalize that it's usually increasing time on task and decreasing disruptive behavior. At the present time, the school counselor and the school social worker facilitate the check and check out at this site. The decision rules for in and out are attendance, teacher requests, number of ODRs, and then also the results on the screener. But after talking about that, we realized that we don't have a way of drilling down on the screener to find out more specific needs, and so that's
Good.
an area we want to get more into. How many participating? We didn't have the exact numbers, but we know we're within that range of like 10 to 15%. We realized that we are not monitoring progress very well. We're just kind of saying, oh, they're doing okay, but we don't really have any data that we're reviewing on a regular basis, and that's an area we need to
Good.
change.
Good.
And it is an it would be an evidence-based practice
Yes.
if we,
Well, yes, it is evidence-based. Are you implementing with fidelity?
not quite.
Okay. Those are 2 different questions, right?
Yes, they
Good.
are. And then we discussed another intervention. We have social skills groups, but at this time, it's definitely not an evidence-based intervention just because of the way it's being implemented. And we talked about how we can change those interventions to become more evidence-based.
Okay. Wonderful. You can see how this conversation for a team really helps you examine at the building level. Remember that. What is our current status, right? And if we can get some improvement in these areas for ourselves, we're probably going to see improved outcomes for our kids, or we're more likely to, right? Excellent. Good job.
She said a lot of exactly what we talked about.
Okay.
We use check in, check out, same district, same pretty much systems, exactly the same piece about data, what brings kids in, what gets kids out. A lot of our discussion too was around the teachers requesting that help and not often being willing to provide us the data to do that. So we don't really have a clear reason why the student needs that or what they'll need to do to get out of it. We also use social groups as one of the other Tier 2 interventions. And again, they all just vary based upon what the students need. But I think as a team, we also need to look at our Tier 1. Like if we have these kids coming in, what are we doing at Tier 1? And is there something else we could do to?
I may or may not have been eavesdropping on your discussion. And I heard
Sounds
you
like you
talk
were.
about, sounds like I was, I heard what is a common conversation. What about the kids who may be experiencing depression? And what are we doing to support them? And what is the data that we're progress monitoring? Because sometimes folks feel like it gets a little trickier if we're talking about the kids with internalizing, because we don't necessarily see how it's manifesting. Except if, remember what we talked about, frequent visits to the nurse, withdrawn, quiet, crying. And what are the skills we teach? It's still any of us, if we're experiencing a stressor or anxiety or depression, we have to learn how to cope. And for our kids, it's, and how do they navigate the school day, right? And so it's your team taking the conversation farther and then talking with all your staff and families and et cetera about if it is something like depression, we've got to hone in and drill down on what is the data point that we want to keep an eye on and change, and then how are we going to progress monitor that, and here's the skills we're going to teach, right? Yep.
Going off of what you just said about the check-in, check-out.
Time out. Time out.
No, you can go. I'm glad I did not move. With the check-in, check-out,
it's also helpful to have an emotional check-in, check-out with those students, and you do something very easy as to put a 1 through 5 scale, 1 being, I feel the most depressed I've ever felt today, 5 being, I actually feel pretty good today. And it takes a few minutes, sit down, say, hey, how you feeling today? Or you could use
Or
the
that
stop
thermometer,
sign, the
right?
thermometer, depending on what age level you use. And you can track that data as well, so you can start to see, wow, on Mondays, you're really a 2 on Mondays, but by Thursdays, you're more of a 4. What happens in between those 2
Yep.
days?
Wonderful. Great. Yes.
For younger kids, where numbers might be difficult, you can have a scale like they have at the doctor's office with the smiley faces, and then you operationalize that data with a ruler. You start at 0 over here, and you say, today we were 3.25 inches, and tomorrow we're 3.75 inches. But from the child's perspective, they're just marking where they are on the smiley face. But then you can actually convert that to numbers that are measurable and trackable with just a ruler.
Here's another activity. We're not going to do this one right now, but remember, you've seen that kind of conversation slide throughout. This is another opportunity for your team where you could say, who's on our team and is anyone missing? What are our current practices across tiers? What are our data decision rules, right? And then how are we going to know, based on our data, remember that idea of kind of dropping it down. So if we've got more than 20% of our kids in any one data category, we need to be thinking about doing something at tier 1, right? And so these are the ongoing conversations that you're going to want to have around your data and around what you're doing to respond, okay? We're going to skip some of this, sorry. All right. Roles and functions when we get to tier 2, okay? You've heard us talk already about thinking of the changing role of the school clinician. So your counselors, social workers, psychologists, how are we going to make the best use of their expertise? And what other adults do we have in our buildings that we can tap to help us facilitate interventions in our continuum, right? And so this actually comes out of our changing role for the school clinician PowerPoint slides, but you can sort of see here. If we're talking about check in, check out, for example, someone needs to coordinate the intervention, and then we need people to facilitate, the ones who actually check in and out with kids at the start and end of each school day. We've got to make sure we've got enough of those facilitators for 7 to 12% of our student body at any one time, right? The coordinator is the one who keeps track of the data. They can monitor and bring to the team meeting. Right now, we've got 30 kids in check-in, check-out. Only 3 are making progress. We probably should check and see if we need to reteach and provide training for the teachers on check-in, check-out, okay, or whatever. We've got 30 kids in, and 28 are making progress. We have 2 that we probably need to have a problem-solving conversation about. I think they need something more, whatever. Same thing with other interventions that you may be facilitating. You've got to have someone to coordinate. Now, as we get into thinking about a group, the coordinator might also be a facilitator or a co-facilitator, right? We can wear multiple hats, but it's important to have conversations about all of these things, okay? Here is, again, that TIPS meeting form for Tier 2. This one is all about check-in, check-out as an example, but it has right on it. Here's the data decision rule: 2 office referrals within a 2-month period, or 6 classroom managed incidents, okay? There's lots of these kinds of examples available for you to look at. All right, we've spent some time talking about screening, so I'm not going to spend a lot of time on that here because we need to make up some time. We're going to run out. Again, as you move into higher levels, we can still utilize that daily progress report. We can utilize what we're doing for all kids at Tier 1 around the teaching of social emotional learning. And then we have to make some decisions around, for example, are we going to have a small group and we're going to teach some coping skills and we're going to use our second step curriculum that we teach at Tier 1 and pull out some of those skills that focus on coping? Or does our data indicate that we need to select a specific evidence-based intervention that addresses the issues that we're seeing for our kids who need coping skills, right? So you have to have some of those decision points around what it is that you're going to do. So here is another matrix example where technology was identified as a problem. And by the way, what we're learning as we explore why we're seeing this prevalence around some of these mental health issues is there is this whole element to social media and this term called electronic aggression, which is a term that the CDC coined. Are we out of time? The timer went off.
I'll keep trying.
All right. So here we have, if we're respectful with technology, pause and reflect before you post or hit send on an email. Adults. If we're achieving and organized, check your feelings. Reread the message. Responsible, model for others. Double check your sources. Consider the feelings of others. Right? So clearly, this is an example that is high school, but again, kids are on technology all the way down to the wee itty bitties. So we have to start incorporating teaching around that. And if we find in our school that this is a significant data point, we've got to make sure we've got it in our matrix. Okay? Susan, anything you want to add on that one? People email us all the time and say, just give me a list. Give me a list of evidence-based practices that I can use at Tier 2. Give me a list of a continuum. Just hand me one and we'll do that, right? Remember what we've been talking about. You, as a team, at the building level especially, have to explore and adopt an intervention that's going to best meet the needs of your students, okay? So here are some websites that you can go to and find evidence-based interventions. And then, now, so after I told you we don't make lists, here's a list, by the way. You have to sort of say to yourself, what is our goal? What do we want to do? All right? So you can go and find a whole list of trauma-informed interventions, but then you've got to decide, do we need something at Tier 1? Maybe we could consider support for students exposed to trauma because teachers can do it right in the classroom. You don't have to have a clinical degree, and that way we could do it at Tier 1. Or if you want to facilitate a group and it's for older adolescents, maybe you want to use Sparks, but look, it's recommended that you have a mental health clinician with a master's degree to facilitate it. So you've got to kind of go through, remember our let's have a protocol and a process for what does our data tell us? Do we have a need? Does this fit? Do we have people who can be trained to put this intervention in place? All of those things, right? And so you've got to do that each time you're making a decision around an intervention. All right, and so then remember, with all of our interventions, so we've talked about check-in, check-out. If you're going to facilitate a small group, you still have to make sure that anyone who's going to be connected to the kids who are going to be receiving that intervention understand and know what it's all about. So that if I'm the teacher, I know the skills that are going to be taught, I know the words to use, I know what to watch for, to prompt, to pre-correct, to give feedback to the student, right? So that's one thing that we're writing it maybe on that daily progress report. We also have to make sure that we're talking with folks and communicating about what's going to be happening, okay? We've got to do the same for families. We've got to make sure that they know and understand. And it's a great idea if we can put it in writing, okay? And then you've got to decide who's going to deliver it, when's it going to occur. And so this can be tricky. We know that there's never a good time to sort of pull kids out of instruction to facilitate a group. You saw the example earlier where maybe it's going to be at lunchtime, that that high school that did the nest time and they had an extended lunch period, that might be an opportunity. Or I've seen schools where for check-in, check-out, they have a homeroom where those kids all go to that room at the start and the end of the day. Or Susan and I were talking on the break, maybe kids who have a similar data point all get plunked into the same math class, and the first 10 minutes are spent on coping skill instruction. Because we know that we're not going to be able to get to the math lesson until the kids are ready with their mind to focus on math. So we've got to get clever and creative about when and where we deliver these interventions, okay? Questions about that? Anything else you want to add? All right, so here are some possible decision rules that you might use or consider for your team. And remember, we don't want to look at the data in isolation. You want to look at all these data points together because you'll get a different picture when you start to look at it in that way. Here's some examples. We saw one of these yesterday. This one's for check-in, check-out. And you want to get really specific, right? If they come up on the screener, if they have 2 or more ODRs, 10% time out of class, or someone writes a referral. Then they've got what they're going to progress monitor. Any of you use check-in, check-out, Swiss? Okay, good, good, good. All right. And we would prefer kids don't graduate high school still on a daily progress report. The goal is to get these skills internalized and move them off, okay? Sample daily progress report again. Whoops, sorry, I can't get it to work and then it works too well. Here's skills being taught in a trauma-informed group, written right in. And even if you're not going to touch on each skill each week of the group, let's say, they're still on there so that we can all be mindful of what they are, right? So remember, all of these items are in that action planning companion guide. And it really gives you, what do we mean? What's it look like, sound like, feel like at the building level when we have a single system of delivery, okay? And so here you can see the team together selects the intervention and makes those decisions around who's going to facilitate it, okay? This is different from, I think I gave you this quick example earlier, where the clinician says, and I actually had this happen, I'm using zones of regulation with kids in small groups or individual. Zones of regulation is an evidence-based intervention. I have no issue with that. I do find it hard to believe that the presenting problem for each child indicated that zones of regulation was the best match. So we've got to do a better job together to make sure that we're matching interventions based on need, right? Not what we've always done or what we're comfortable with or what we were trained to do, okay? All right. So I'm going to kind of move us along because I want to make sure, yeah, we need a break, and that we really get to giving you some more examples